When in distress, every man becomes our neighbor. From the ancient Egyptians to the 21st century, the practice of medicine, despite how primitive, has been used for generations to heal the sick and aid the injured. As such, it is no surprise that medical technologies have greatly improved throughout the ages. In the early years of the United States, most medical personnel began by using unorthodox techniques such as bloodletting, lobotomies, and tobacco enemas to cure certain ailments. In addition to these flaws of practice, only wealthy individuals were guaranteed medical attention. During this time in history, hospitals like the ones of today did not exist, but rather doctors would receive house calls from their rich patients. Upon receiving these calls, the doctor would personally travel to the patient's home with a kit full of his medical instruments. On the other hand, poor people were denied the luxury of hiring a doctor to come help them. Instead, the penniless had to rely on their family members to help nurse them back to health, or they would try to receive help from an almshouse, a hospital for the most impoverished of people. Some people of this time believed that the quality of care of the sick based on their financial status was morally unjust. Specifically, two doctors from Boston, James Jackson and John Collins Warren, believed that it must always be considered the first of duties to visit and to heal the sick. In fact, these two men were such proponents of establishing a hospital that they wrote a petition on August 20th, 1810, entitled the Circular Letter, which stated that it has appeared very desirable to a number of respectable gentlemen that a hospital for the reception of lunatics and other sick persons should be established in this town. The goal was to create a general hospital that would be open to everyone, no matter how rich or poor the person. Eventually, the dreams of these doctors came true when the circular letter led to the establishment of the Massachusetts General Hospital, and although it was not the first hospital in the nation, it was the first hospital that made it easy for anyone to be treated. Therefore, Massachusetts General Hospital revolutionized the public healthcare system through its foundation of the first public hospital in New England, while spreading its legacy of availability and affordability for all.
Before the Massachusetts General Hospital could inspire other hospitals to be built on the concept of available and affordable care for everyone, it started off as John Bartlett's dream of a better way to treat the sick. At the time, Reverend John Bartlett was chaplain of an almshouse in Boston, where he joined with like-minded doctors and leading citizens to organize a fundraising campaign. Along with Dr. James Jackson and Dr. John Collins Warren, John Bartlett and his supporters received a charter for the creation of Massachusetts General Hospital in 1811 from the Massachusetts legislature. As fundraising proceeded, the trustees bought an estate in Charleston in 1816, which would later become McLean Hospital, a mental illness facility of Mass General. Soon after, in 1818, the construction of the main portion of the hospital began, and the original building, the Bullfinch Building, opened on September 3, 1821. After its opening, the hospital received its first patient, who was in need of treatment for syphilis. In its first year of operation, Mass General also became the first teaching hospital of Harvard Medical School. Since then, Massachusetts General Hospital has led the way in medical advancements and has greatly influenced other hospitals with their achievements.
When we think of the tremendous progress that's been made in medicine, and even way back then, fellow citizens were concerned about caring for their neighbors. And the Massachusetts General does more than care for the people of that area. There are over 1,000 students studying various parts of the hospital all over the world. And the influence of Massachusetts General stretches really around the globe.
Massachusetts General Hospital has demonstrated its leadership in medical advancements and innovations since its opening in 1821 through their use of anesthesia, their knowledge and teaching of surgical procedures, and their research into various diseases. It was in the ether dome of the Massachusetts General Hospital where the first public demonstration of surgical anesthesia occurred on October 1846. William Morton, a dentist at the time, administered ether which was inhaled by a pipe apparatus to his patient. Then, John Collins Warren painlessly removed a tumor from the neck of a local printer, Edward Gilbert Abbott. Notice how the procedure is done without screaming or restraint. Besides being the first hospital in the country to use and demonstrate with anesthesia, Massachusetts General Hospital was also the first hospital to successfully reattach a human limb. In 1962, Ronald Malt led the surgical team that accomplished the first replantation of a severed arm. Furthermore, the Massachusetts General Hospital was the first hospital to diagnose the disease of appendicitis in 1886. In addition, Mass General Hospital was one of the first hospitals to offer emergency care to patients. The ambulance system they invested in played a big part of providing help to people in need. Besides caring for their patients, Mass General has always incorporated teaching people the necessities of healthcare. Massachusetts General Hospital has been affiliated with Harvard Medical School since its establishment, and together they have formed an academic health science center. Currently, Mass General reports it conducts the largest hospital-based research program in the United States, with an annual research budget of over $750 million. Whether it is the achievements of its past or the prospects of its future, Massachusetts General Hospital's legacy is always being shaped.
What began as a refuge for Boston's poorest residents has evolved into a world-renowned medical center. And when disaster has struck around the globe, from New Orleans to Haiti to Japan, your staff has never failed to answer the call. That expertise, that compassion, is what has made this hospital a beacon for patients in need.
Massachusetts General Hospital has come so far since it was first established in 1811. Remaining true to the beliefs of their founding fathers, this public hospital has provided treatment to everyone, including the poor, for over 200 years. Massachusetts General Hospital is also open 24/7, making it one of the most available hospitals of its time. The legacy of availability and affordable care for all people has lived on throughout the decades, because hospitals established since Mass General have continued to embody Mass General's original principles. Besides revolutionizing the medical field, their leadership in healthcare has changed the lives of people in the Boston area. Because Mass General Hospital has become a hub for new medical research and advancement of technology in modern medicine, their unwavering commitment to the advancement of medicine is why they are one of the top hospitals in the world today. Massachusetts General Hospital's belief will forever leave a legacy of humane behavior. Its leadership in the early establishment of hospitals will also always be remembered.